So we applied for a grant to study long COVID, and we then took 150 patients from the Mater. A lot of them were staff members, and we did follow-up questionnaires and studies on them to see who got better, who didn't get better, and what persistent clinical symptoms they had. About 30 to 40% of people were still not back to normal, so they were physically unwell. So the only significant p-value was for the was for being physically unwell at 1 year post-COVID. And this has actually been reproduced with lots of other studies, that following acute COVID, about almost a third of patients are still not right a year later. 18.3% of participants had moderate to severe signs of depression. 13% of participants had moderate to severe anxiety. 21% of participants had findings consistent with PTSD for at least 1 year. And interestingly, 72% of participants had concerning alcohol use at 1 year. Now, this doesn't necessarily mean that they were using more alcohol, but they were just turning to alcohol as a way to cope with these with their symptoms. And then we move on to which patients progress to long COVID. And the answer is anyone can, not just those who are hospitalized. Patients are just as likely to get long COVIDs who have mild symptoms, and patients with long are just as likely to get long COVID if they were vaccinated, if they were not vaccinated. There doesn't seem to be significant protection from developing long COVID. And if you're, where is this coming from? Patients usually get worked up looking for a tumor, looking for an cystic neuroma. But similarly, long COVID causes inflammation in the posterior part of the brain. Long COVID could cause inflammation in the cranial nerves that run into the ear. And people can get tinnitus, people can get dizziness as part of that. So it's not just cranial nerve 1 and 2, but lots of the cranial nerves are involved. And long COVID in this report is disabling millions. It may come together in the brain and the nervous system. So the disability is all brain and nervous system directed. I just anecdotally in my long COVID clinics, I've been looking at viral reactivation, and there's a number of patients who are getting new infections with Epstein-Barr virus, or I think they're getting reactivation of Epstein-Barr and other herpes viruses. I'm seeing patients with young adults with 3 episodes of shingles, 33-year-olds with 3 episodes of shingles in 6 months post-COVID. This is very unusual. As an infectious disease doctor, the only situation I've ever seen that is back in the day of HIV and AIDS, and in the setting of transplant-induced immunosuppression, where patients tend to get lots of shingles reactivation, and in the setting of elderly patients with immunosenescence. So besides